Hello, everyone. My name is Reagan Copeland. I am Duval County Public Schools Parent Academy Supervisor. And if this is your first Parent Academy course, we are thrilled to have you joining us today. If you have joined us before, welcome back. I'm going to introduce to you the fabulous Heather Naw. She is with Hazel Health, and we'll take it over from here. Here you go, Heather.
I appreciate you. Hello, everyone. We are super excited to be back at the Parent Academy for the second time. If you guys joined us last year, we had a focus more so on physical health, and this time we are going to talk about mental health. And we are so excited to be Duval County partners now. We have been partners with them for 3 years, going into year 4. If you haven't heard of Hazel Health, this is going to be absolutely awesome for you guys to hear about our mental health services. To date, we have actually completed over 16,000 physical and mental health visits this school year alone. So super excited. Every month, those numbers just keep going up and up. And so we are here to share with you guys all of the great work that is happening behind the scenes in the district and give you guys some more insight in what you can do to get consented and get your child potentially served. All right, so here's our team. I am Heather Naw. I am the account manager for Hazel Health. I primarily am kind of like the face of the district. I meet with district leadership. We go over data, strategize on how we can serve more kids. So again, I'm the district person. We have the fabulous Christina Hanna, who you're going to hear from next. She is our customer success manager. She is out in the schools working with our referrers and initiators. And then we have the awesome and amazing Amber Dutton, who is our clinical supervisor, who is the lead over our mental health program. And then you're also going to hear from our fabulous therapist, Keisha, and she's going to kind of share with you guys what exactly she does in sessions and kind of bring it to life for you. All right, and here are the rest of our therapists that we have in Florida. You can see that we service multiple students. We have therapists that can speak English, Spanish, Haitian, Creole. We also have a language line. So no matter what your language is, we can always get you services because we have an awesome translation program. Again, just more, you guys can see we are very diverse, speak multiple languages, and all of them are awesome and amazing. All right, so who are we? What is Hazel Health? Hazel is the largest and most trusted telehealth solution in school systems today. We offer mental and physical health in Duval County, and we also have at school and at home appointments. We are mental health, which is what we're focusing on today. We can see students from 7 a.m. to 7 p.m. And then our physical health goes from 8 to 5. And again, as long as your child is consented, we can see them for physical health at school as well. Also, what's really great is, we're very equitable. We provide access to all students, regardless if you have insurance or not, regardless of immigration status, regardless of ability to pay. You will never get a bill from us. So that is always great news. It is essentially no cost to families. So who do we partner with? Like I said, we are all over the country. We have over 150 school districts and counting. We are constantly onboarding new students. We have the whole state of Hawaii. We are in Clark County schools. We're in Aurora. We are in Miami-Dade, Broward, Duval, Polk, Hillsborough, Atlanta. All of the big school districts we are in, and we are making it our mission to make sure that all students are heard, seen, and cared for. So why are we different? So this is really easy, and I love to talk about this. So like I said before, regardless if you have insurance or if you are savvy in the healthcare system, it is no cost to families. So we have that going for us. Also, in our program, you can either get a referral from the school, or you as a parent or guardian can consent your child and automatically do a referral to Hazel Health, and then one of our family resource managers will reach out. So we have that as well. Also, we know that there's like a stigma around mental health, and some students might not be able to connect us to services. We have a skilled team of FRMs, which are family resource managers and enrollment coordinators, to help you feel comfortable and guide you through the whole entire process. So once you submit that referral, it's not like we are just going to leave you alone. We're going to walk you through the whole thing and ensure that your student gets seen. So appointments. What's great about this is, I don't know about you, but I have 5 kids of my own, and it's really hard for me to be able to leave work. So you can have your student seen either at home when you're there, what works around your schedule, or they can also be seen at school if you don't have the time or availability or transportation to be able to leave work. And then you can also join our appointments virtually, which is really cool. So it's almost like you're there in person. And then also, several other mental health organizations have a long wait list. So we're talking 4, 5, 6 months. With the way that our platform is set up and in delivering that virtual care, typically you will get on our books in less than 4 weeks. So once you submit that referral, you're going to hear from someone from our team in less than 48 hours, and then the process starts. We can do an intake, and then from that intake, we will determine how many sessions your student needs, and then you're kind of off to the races. You're going to get connected to one of our awesome therapists, and your student is going to be able to be seen.
Thank you. So my name is Christina, and as Heather mentioned, I'm the customer success manager from Hazel. And so I am just going to first talk about some mental health statistics in Florida. And some of these statistics are pretty scary. So you can see that 1 in 6 children age 6 to 7 experience a mental health disorder each year. And then when we look at youth age 12 to 17, 68% of those who have depression did not receive care last year. And one of the most scary statistics here is that 3,567 lives were lost to suicide in the last year in Florida alone. And then you can see here almost 50% of those in Florida who needed mental health care did not receive that care due to cost. And then roughly 6 million people in Florida do not have enough mental health professionals in their community. So again, we at Hazel are really trying to work to break down the barriers for some of these statistics. And so as Heather mentioned, there are a couple of ways in order to get your student into services. So you can see here the QR code will take you to the Hazel page for Duval County schools. So when you are here at this website, you can fill out the online e-consent form. And so that is where you would fill out all of the information about your student and allow Hazel to provide services for your student. Once that consent is completed, in order for your student to receive mental health services, there would need to be a referral completed. And there's kind of almost 3 ways at this point to be able to connect your student to those services. The first way is to contact and make contact with that school counselor and request them to complete the referral on your behalf for your student. Or you can request those services on your parent account. That would be online after you fill out that consent. Or after you fill out the consent form, you can then call Hazel's 1-800 number. So that is 1-800-764-2935 and ask and request services via telephone. So this guardian consent form, the e-referral option, is actually pretty new. So you can see here on the left side where it says next steps, this is what you would come up to as soon as you fill out that consent form. So you can see here, you would then just hit request teletherapy and request that service for your student. If your student is already consented to utilize Hazel, so you may have already completed that consent earlier in the school year, or maybe even last school year, you can see here the screen on the right is what you would view when you log into your parent account. And then again, here at the bottom, request teletherapy, you would just click on that and then request services for your student there. And if you ever wondered what the referral looks like from the school perspective, this is just a little snapshot of what your school counselor or social worker would fill out in regard to your student. So it's just a little bit of demographic information and then the reasons for referral and the free text box to allow the school staff to fill out any of that information pertaining to your student. And then it also gives them the option here of what scheduling looks like and works best for your students if they are going to do sessions at school. And one thing you may have questions about is why Hazel requests insurance information if there is a no cost for the family. So when we are able to get that insurance information, it allows us to have better care coordination and allows us quality, timely mental health care for your students. So our team does bill insurance if we are able to, but insurance is not required to utilize Hazel services. And even if we do bill insurance, there will absolutely be no out-of-pocket cost for your family, and you will never ever receive a bill from Hazel for any of the services provided. And then there are a couple of ways that you are able to submit your insurance information. So you can enter that information when you are completing that consent form. And so if you do not have a physical copy of the card to be able to submit that, the picture of the front and the back of your card, you can also enter the details manually. Or you can also, again, call that same 1-800 number and submit your insurance information over the phone. And so now I am going to hand it over to Amber, who is our clinical supervisor here with Hazel, who is going to talk first about how students access the mental health care.
Hey, good afternoon, everyone. And so, as was mentioned earlier, our referral process is pretty swift in terms of getting students the care that they need. And so, again, the most common referral resources are going to be from the school or you as the parent. However, we also do receive referrals from our physical health providers if there was a physical health visit initiated, and we see that maybe there's more of some social emotional concerns. Once that referral is again made, as Christina mentioned, we want to make sure that consent gets completed. And we often find that this is the biggest barrier for services moving forward is if either your student, if they're 18, or you as the parent have not completed that consent, we cannot move forward with getting your child to that intake appointment. The consent, again, as Christina mentioned, is an electronic one that you can access, and it should just take a few minutes to be able to complete that. Once you've done that, then again, we'll have our Family Resource Manager outreach to go ahead and get that behavioral health assessment scheduled. What's important to know about that assessment, we understand that, for many of you, this is your first experience with mental health services, and so you may not understand what all is entailed. So the behavioral health assessment is a 75-minute or about an hour and 15-minute appointment that is scheduled with one of our Florida intake therapists. We do ask that the guardian be present for that because we're getting a lot of heavy information that includes, mental health history within the family, family history, as well as just understanding really the holistic picture of what may be going on with your student. And so it's very, very helpful to have the guardian present for that fullness. And so, we encourage when scheduling that you think about a time that you are able to join, whether that's physically being present with your child or again, if it is a school-based intake, how you can plug in virtually during, your workday. Once that assessment is completed, this is really where that intake therapist is going to work on understanding the best treatment plan for your child. And so this is going to entail understanding, are there additional services or supports in addition or beyond Hazel that may be beneficial for you? This also is how we identify what the session planning looks like to ensure that while we are short-term therapy, we're being clinically appropriate and offering the right amount of sessions. Once that happens, you meet with your therapist, who will then go through those ongoing sessions. And once we get to that discharge process, that's really, again, where that therapist is going to communicate about any additional supports. They may let you know about a re-enrollment process, or again, connect you with your assigned family resource manager. And then again, that assigned family resource manager outreaches within about 6 months just to check in to see if there's any additional supports that you may need. So how does Hazel help your student? This is a wide list of different reasons that we have seen for referrals. So on the right, you'll see our top 10 reasons. Anxiety and depression and sadness and academics are some of our top ones, but we honestly see a lot of students that come in with grief, whether that's grief within their immediate family, grief of a peer. We see a lot of grief as one of the presenting concerns. And so we ask you just to be able to think about this. Have you noticed changes in your child's behaviors, whether that's eating patterns, sleeping patterns? Are they a little bit more reserved in class? Do you feel like you're getting called by the teacher, or that there's been certain instances that have gone on at school and it's escalating? Our aim, again, for Hazel is providing that early intervention. And so our aim is to be able to support where we can, partner with your school, or again, partner with other communities, resources to be able to get the care for your child that is needed. And so we can go to the next slide. All right, so this is a lot on this page. Take it in, but you'll again be able to review this later. But wanted to share some helpful reminders during and after Hazel services in these 3 bucket points. So for eligibility, what's big to note is that all students that are within DCPS, as well as Duval Virtual Academy, are eligible for our Hazel services. If your child changes schools and is attending another Duval public school, it's super, super helpful to let our therapists know, just so that we can ensure that we have that data updated within our system. And again, if that child is able to receive school-based services, we want to see if that next school they're at is eligible for services as well. If you're moving out of district, or if you're participating in like Florida virtual or any other kind of homeschooling programs, unfortunately, we would not be able to serve. And so it's super helpful for us to know that. That way we can still coordinate care and support you with identifying long-term resources. One of our big ones that we know is that when students are 18, whether they turn 18 in the midst of services or they are referred in our 18-year-old, is that there is a student consent form that they must sign, and this does have to be done on a school iPad. And so we do explain that. So if your child is 17 and turns 18 through the course of services, we do communicate with you as the parent to inform you. And if the school has referred, we'll also communicate with the school. But after that point of them getting situated, we do funnel all of our communication directly to that student because they are 18. And so we also want to make sure that they have a student account. So again, as was mentioned earlier, when you guys enroll in services as parents, you create a parent account. But when they turn 18, they actually need to create their own account so that our communication can again funnel to them. And then again, we really like to make sure that we're not duplicating services. So this is a big one that comes up with us, is understanding, is your child receiving any other type of individual therapy, play therapy, talk therapy? So unfortunately, in the clinical world, we call that duplication of services. So if they are receiving services at another agency or organization, Hazel cannot also provide that same individual therapy. Now, there are nuances, such as if a child is in family therapy and they're coming to us for individual, that's a little bit different, but 2 therapists cannot both be providing individual therapy services. So clinical care, what does this look like? So we have a partnership with Duval. We have what's called a district health protocol. So this means, and our therapists are encouraged to say this both in the intake and their ongoing sessions, that about their confidentiality statement. So if a student discloses bullying, self-harm, abuse, suicide, or homicide. These are some of the key indicators that we do have to disclose this information to the school district. And while we ensure confidentiality within our sessions to the best of our ability, there are certain scenarios that we do need to escalate and make sure that the school is informed of. And so sometimes a therapist may outreach to you to let you know that they do need to make a report, or else they do need to inform the school. And this is just our processes that we have. One of the other things that you may hear is that, again, our heart intake therapists are going to identify in that intake if additional services are needed. So you may hear them discuss with you about the need for a long-term referral. And this also is going to indicate the number of sessions that we may be offering. And so again, we are a short-term model. And so sometimes we know that our kids have the greatest relationships with our therapists and they want to continue forever. But we do have to let them know that we are short-term. We also like to discuss higher level of care. And so if there are, even though we support students that come in with all different types of needs, when we identify that students have higher risk factors, so again, if they've had suicidal ideation, multiple suicide attempts, have been hospitalized, have more of the severe mental health, then we want to make sure that we are getting them to the appropriate care. And so sometimes these conversations are going to happen either at your intake or through the course of your ongoing sessions with your therapist. And we do like to note that we are not an appropriate step-down services. So if a student is just coming out of an intensive treatment program, or again, had a recent hospitalization, we do like to bridge that gap and support when we can, if there is a long waiting list at another organization, but we usually are not that first point. And so sometimes we do have those conversations with you as the parent as well. And then our re-enrollment process. So we do like to go, and the therapist and intake therapist should both go through you what our discharge policy looks like. And so that is just to discuss kind of our compliance with when we have those at-home sessions. When we do have school visits, we do try to make sure that we are coordinating with the school to get that student served. And so our discharge policy looks different from the school perspective versus when it is a home session. For re-enrollment purposes, we have a minimum of about 60 days before a student is eligible to re-enroll. And a lot of times that comes down to a consultation with myself or our other clinical team to understand what those students' needs are and why they're presenting back to services. And so sometimes we may identify, if we did recommend long-term care, we want to understand if there were any barriers or anything else that we can support with as to why the student may be returning to us. And again, as much as we love for continuity of care, like our great Ms. Keisha, who you guys will hear from in a bit, sometimes, we do like to let you know that students are not guaranteed, if they do return, to be with their previous therapist. And again, if we see that there's multiple re-enrollments, this may indicate that there is a higher need of care. And so that therapist may also talk with you about additional supports that they can offer. All right, so working with the heart providers. So our heart providers, again, are trained, fully licensed therapists. So they're either licensed clinical social workers, licensed marriage and family therapists, psychologists, or licensed mental health counselors. And they have worked in a variety of settings. We have such a diverse group of our therapists that will work with your kids, as well as they have just so many years of experience, and they love the work that they do in working with kids. And for us, that's really, really important. And so again, they're going to identify other treatment and supports that may be needed within Duval. They're going to communicate with you through a phone call or again, chat through that parent account. And as Heather mentioned earlier, we have multilingual providers that speak Spanish, French, Haitian Creole, Bosnian, Croatian, Serbian, as well as we can utilize the language line for other languages as well. So what does a school session look like? So again, for our school sessions, we currently offer school appointments within 20 designated Duval schools. And again, this will be discussed at the time of your intake appointment if that school is eligible for at-school services. So these are some pictures of what it may look like. We really encourage our schools to be super creative with the spaces that they utilize. So the way it works is that the student is going to join from a designated Hazel iPad. We provide 2 iPads to each school that we have both mental and physical health services. So there's one iPad for mental health and one for physical health. The parent, again, you'll get a link. So anytime that we schedule appointments, you're going to receive text messages with the appointment reminders. And so when we first schedule out those appointments, don't feel overwhelmed, but you may receive, 6 to 8 text messages all at once because you get notified every time a visit is booked. And so again, based on that clinical discretion, the therapist may invite you into that session. We do focus on individual therapy, but at the clinical discretion, you may be involved in the ongoing therapy sessions after that intake appointment. And then again, we do make sure that we have school staff around. So, we encourage that the school staff are not in the room with the child, but that they're outside of that designated space. And we also have a way to chat with the school virtually in case we need any additional support, the student is in a crisis or anything is needed. We do have a way to immediately outreach to school for them to come back into that session to support those student needs. And with that, oh, I got one more. So for home spaces for therapy sessions, just a couple of key things to be able to know. So again, when we say that a session is at home, still know that it's a virtual therapy session. So I know sometimes that parents get confused and think that a therapist is going to actually physically come out to the home, but it is still virtual. And again, you can join from the convenience of a computer, a tablet, or a cell phone. And so you're going to receive reminders as a parent 2 days before, 2 hours before, and 15 minutes before that designated appointments. And we do ask for at-home visits that an adult 18 or older does need to be present, and this is just for safety concerns. So should anything come up, we do want to make sure that we do have an adult that we can check in with. And so again, for the intake, the legal guardian needs to be present, but beyond that, for just ongoing sessions, it just needs to be an adult, and that could include a sibling who is 18 or older. So what do we know? So we know that, sometimes students and families feel more comfortable doing a session at home because it allows for that child to open up more than doing it in a public setting. So we do encourage, as much as possible that you're not in a moving vehicle. We understand that sometimes a session has to occur in a vehicle, but we ask that the vehicle be parked over and that we can identify if it's a parking lot or the nearest location, again, in case there's an emergency that comes up. But again, having a session at the swimming pool, in a grocery store, at the nail salon, things like that, we do find that sometimes can impact the clinical care that we can provide. So we do like to make sure that home is the best place possible. Again, and it really helps to build that sense of support and build that relationship with the student and the therapist, as well as you, the parent, to be able to input, to notice the progress that's going on, some key things that maybe you want that therapist to work on. And so sometimes we find that, when you can go a slower pace and have a home session, that this is a better approach clinically for that child's needs. And with that, I believe that I am passing it over to Keisha, who is one of our Florida therapists, who will talk to you a little bit more about her role.
Good afternoon, everyone. So I'm going to start off by talking or continuing following up from Amber, talking about the different spaces that we hold our therapy sessions in. And so this one is the area that the space that the therapist has. And so this is my personal space, and every therapist is a little different, but in all, what we do focus on is that it is, of course, remote. So just as Amber was saying, we are also not at the nail salon or in the parking lot doing the sessions, right? We're in a private space to keep your privacy for your family and your children as well. And so we are meant to have a private office where the door can close and it's locked and it's quiet. And so this is, again, kind of the setup that I have. We do like to try and keep our space creative. And by that, it's different for everyone. So for me, it's kind of in the background in that second picture, but I have a lot of books and a lot of resources. And that's where I pull a lot of different lesson plans from, which we'll talk about in a little bit. And then, of course, different tools that we utilize. With the little ones, we might have some puppets. With the older ones, we have resources that we can send to them, email them, or put it in the chat. That way they have additional resources, as well as sending resources to the parents as well, so they are involved in the care of the services. And so, as a therapist, best practices for engaging with children virtually, because it is different than meeting in person. There's a lot of different things that you have to take into consideration, and again, be creative in how we present our activities and lessons to them. And so some of the things that we like to consider is, or at least be able to talk about it, talk about, again, um, as Amber mentioned, the different services or the different reasons that maybe one may come to counseling. We like to discuss that with you and the student to see what the concerns are. A lot of times, the parent concern may be different from the children's concern. So it's good that we are able to like get all that information and that way we're addressing everything. And of course, once again, as mentioned before, some of those concerns could be trauma, it could be peer social skills, it could be family concerns or conflicts. A lot of times it could just be changes, changing from one school to the next for a student could be a bit difficult, or even moving. And so, with regardless of what your concerns are, that is something that we'll be able to talk about and gather that information. And so then, again, we want to be able to or have the parents think about it, right? So think about what is best practices or best ways that you feel your child might engage in virtual therapy. One of the things I like to always say to the parents is that you are the expert of your child, of course, right? I am not. And so that part is for me to learn from you what works best for your children. And so we can apply those, make those adaptations, and fit it into a virtual setting. Um, Also, with that, we talk about just, the setup for your child and what that session may look like. So our sessions could be anywhere from 30 to 60 minutes. Of course, for the younger ones, sometimes that might be closer to the 30-minute mark. But we, of course, have older students and teenagers, and they do require that full hour. And so again, having that discussion of what those sessions could look like, and that helps us prep for it. And so from there, we're able to gather that information and then we can discuss different options that we have for therapy and what may be best suited for your student. And so, with that, may be even additional resources beyond Hazel Health of different things that you can use to follow up with after we complete our sessions together. And so from there, the families are able to learn about the different services that we have at Hazel, how we can modify those virtual sessions for their student, and then any follow-up referral additional resources as well. When we plan, so the planning part definitely comes kind of on both our ends, the therapist and the family, right? Especially when we're talking about home settings or even schools, right? Then it will be the staffs. But we plan as therapists, we plan for our sessions. We like to have a good setup for it. And then we also, when you think about planning, it's also the family's planning to set up their student for that session, whatever that may be. I always say a private, comfortable space, bring the snacks in, bring a blanket, whatever you feel like you may need for those sessions. And so with that, once we have all that information, then me as a therapist, I am able to plan the future sessions, what the activities may be surrounded. Maybe our focus is anxiety, or maybe even executive function, which we'll be talking about a little bit. And then from there, I'm able to plan the different lessons for each session that we may have. So that brings us to more about session planning, as I mentioned before. And so, again, it really starts from gathering that information and getting basically what works best for that student. And then from there, we're able to, again, do those modifications and create the perfect or the ideal setup for virtual sessions for the students. And so some of those things consist of us obviously reviewing the intake. So the behavioral health assessment that you would do with the intake coordinator, we review the as a therapist, we review that prior to our first session with the students, and then from there, we have any additional questions or concerns, we might follow up with the parent to get additional information from there. And then, of course, that is a way for us to call and formally introduce ourselves to you. So that's part of it too. That goes part into the planning. And then After that, we set up the sessions and we prepare for session one. So planning for session one, we want to make sure that it is, or all the sessions really, make sure that is age appropriate. And ideally, the idea behind session one is to build rapport with that student. So we know that doing counseling may feel uncomfortable to them. Doing it virtual may add an extra uncomfortability for them. So we want to be able to take that time where we are able to talk to them, um, get them in a comfortable setting of just talking to someone that they're meeting for the first time. And with that, we do different activities, different icebreakers, just to get to learn more about them, learn about their personality, and of course, allow them to ask us questions. And then we take some time to discuss what the counseling process actually looks like. And so, this is a treatment plan or overview of what an example of what it could look like if the child's focus might be executive functioning. And so there is a clip here that we will play that talks more about executive functioning and exactly what that is. And so after the intake and talking to the family, if it seems like the student might be struggling with this area, and again, this is an example, so maybe it's anxiety or depression for someone else, but this video or something like this resource will be good to share with the family so that way they have an understanding of what are some difficulties that their student may be facing and then how we to address it. So we'll watch the video and then I'll talk through some of the what some of the sessions will look like in an actual activity.
Executive function is the brain's air traffic controller. It intercepts a tangle of inbound thoughts and impulses and steers them towards productive outcomes. Executive function helps students stay focused, plan ahead and set goals, regulate emotions, monitor their own learning, and think flexibly and creatively. But children aren't born with executive function skills. They develop over time. In fact, the prefrontal cortex, the part of the brain which houses executive functions, is still maturing well into our teens and 20s. So teaching executive function skills should start early, be reinforced regularly, and continue up through high school, at least. How do you do that? Don't just teach content. Look for ways to take a step back and give students the skills and the discipline to learn on their own. And remember that failure is part of the process. Academic preparation needs to be taught. Show students how to use calendars and to-do lists, for example, to manage their time and plan ahead. Encourage students to ask questions like, do I have a plan for succeeding at this? What was confusing or difficult about that task? How can I do better next time? The research shows that metacognitive strategies lead to better preparation, planning, and performance. And high stress levels can impair executive function. So consider activities like mindfulness or meditation to help students deal with stress. And don't skimp on recess. Spend the time. The research backs you up. Executive function is a more accurate predictor of success than test scores, IQ, or socioeconomic status.
All right. So again, that is a resource that will be perfect for parents to give them that education and background on what executive function is and kind of give them an idea of some of the activities or lessons that we'll be doing in the sessions together. So just to dive deep and give an explanation of what an actual session may look like. Let's say we have an 8-year-old Sam who was referred to Hazel Health Services due to peer conflicts and academic concerns. And through doing the intake and talking about it with the family and gathering all of that information, we identified that executive function may be an area that's difficult for Sam. So one of the lessons sessions that I may do with Sam is the bucket list scavenger hunt. And so this lesson is really fun for students because it is able to be adapted, of course, for virtual sessions and allows the student to be interactive as well. And we're able to then talk about things and it helps to plan for the future, right? And so with that, it focuses on the executive function skill of planning and organizing. And so, one part of that is modeling. So when we're in session, we like to model any type of coping skills or problem solving skills that we are introducing to the students. We want to be able to model it. So for executive function, what that would look like is me explaining to Sam, hey, this is the plan for our lesson, right? So first, we're going to learn about the bucket list. We'll learn about what a bucket list is. You're going to create your own bucket list. And lastly, we're going to talk about it. And so kind of giving them that guidance and modeling for them what planning and organizing will look like. From there, we would obviously go through the lesson and find different things that Sam may want to add to his bucket list. This is actually a good lesson that I typically do around this time of year as far as like a summer bucket list, different activities or things they might want to do for the summer. Um, and so we might explore different things, finding different objects around his house or his room that he can show me, talk to me about, explore that with me, and then together we can kind of plan out what that bucket list is. So on the side here, you guys can definitely take time, but this is kind of the outline for the different sessions that we have for the students. And so this is an activity that I would typically do around session 3. And typically around section 3, because then the idea is that Sam is going to practice utilizing this bucket list. And so then that leaves me the additional sessions 4, 5, and 6, or more, depending on the need of the student, to kind of follow up on how that's working, work out the kinks, address any other difficulties that Sam may be having around this topic. And so, again, that is a activity that I like to do with our students, and it's just an example.
All right. And so with that, we wanted just to see if you guys have any questions. I know we have a little bit of time left. And so if you have questions, feel free to put them in the chat, or if you want to raise your hand, let us know. Again, you'll see here the QR code for our Hazel consent form as well, so that if you are interested in services, then you can just go ahead and scan this code and get the process started with completing a consent. But at this time, we just want to turn it over to you guys to see if you had any questions for us. I see, Luann, that your hand is up. Yes, ma'am.
Hi, can you hear me?
Yes, I can.
Hi, my question is, so if you offer virtual counseling services, what if you're on spring break, you and your child are away on spring breaks, and you're outside of the state of Florida? I know you said you're contracted in several states, but for instance, if you're in whatever state it may be, let's say Texas on your break, can you is the kid still able to have a virtual visit if out of state?
Yeah, that is an excellent question, and it comes up quite a lot. Unfortunately not. So the way it works is our therapists have to be licensed in the additional state that you're in. So if we happen, so like for me, I'm licensed in Georgia, Florida, and Virginia. So if I was your child's therapist and you went to Georgia, technically I could get away with it because I am licensed in that state as well. However, most of the time what we do is we ask our therapists ahead of any upcoming breaks, whether that's summer, spring break, winter break, what the family's plans are, and if they're going to be out of town, and that therapist is not licensed in the state, we would just either skip that week or try to go ahead and reschedule for an additional week. But that's a great question because that comes up a lot. And sometimes best practice is the therapist always ask the location before a session starts, just to make sure that maybe you as the parent, forgot to remind us that you were going to be out of town. So we do like to double check that. But that's a great question. Thanks for asking.
Thank you.
Of course. Any other questions that we can answer for you all? Well, let me see anything in the chat. If you bill insurance, how do the required copays get taken care of? Great question. So we bill, so as it was mentioned earlier, we bill the insurance directly. So sometimes what you may get in the mail is like a statement. It is not anything that you pay. There is no copay at all that you cover. And so this is us. So through our clinicians who complete their progress note and they select a billing code, then that gets submitted directly to your insurance company. And so there should never be anything that you're paying out of pocket. And again, what we say is that not having insurance is also not a barrier to accessing our services. We do support without it. But that's how it works, is that that is a process, an internal process that Hazel has with insurance companies as we get our therapists credentialed. And so they navigate that directly with them, but there's nothing ever that should come to you.
I have a question. So if you're at home with your kid and they're on a virtual visit with you, how do you handle crises? Like, for instance, involuntary or voluntary Baker Act?
Yeah, great question. And definitely, Keisha, if you want to chime in, let me know. So again, what we do is we ensure that, again, this is why it's great that our therapists are fully licensed. Our role as clinicians, for the purposes of Hazel, we do not Baker Act directly. So we do not put that on the therapist. But this is why we like to make sure that, again, that adult is home. What we usually are doing is kind of guiding through that process. Do you need to call 911? Do you need to hang up off this phone? Do you understand how to get to the ER? This is what that process looks like for you to be able to get a crisis assessment complete. So really that therapist is walking you through the steps. That therapist may stay on the line with you or direct you towards certain things to ensure. And so sometimes maybe that's getting the mobile crisis team to come to where you are. And then again, if it is at school, this is where we bring the school back in. And when it's at school, then the school is going to follow their normal procedure of how to escalate. But I will turn it over to Keisha to let her chime in on anything else that she has done to support students.
Yes, I just wanted to add to that, again, that's the part of us talking about it, right? And gathering those concerns. So if we know that that is a history or a past concern from the parent or the student, that's something that we actually talk about in the first session, is what is the plan if the child was to have a crisis? And that way the parents feel a little bit more prepared if it were to come up, but we have that plan right from the beginning. So then as the sessions go on, if that concern comes up, everybody's a little bit aware and knows how to address it.
Great questions. Keep them coming for sure. And so, as it was mentioned before, again, our services are 7 a.m. to 7 p.m. I can tell you that most of our therapists truly work kind of starting at 8:30 or 9. And so again, we offer support. We are Monday through Friday. And, we really like to make sure that, your child is getting that clear care that you need. And so, again, what we do encourage, this does happen too, if there is, again, as you mentioned, when maybe something happens on the weekend, right? And you really want to inform your therapist of it. It's okay to send a chat to them. However, what that therapist is going to talk to you about is making sure, again, those resources. If it's after hours, Keisha is a perfect example. She works a 4-day schedule. So she works Monday through Thursday, 9 to 7. And so she's not available on Fridays. And so we would want to make sure that should anything come up, if there's any concerns, that either you can call the 1-800-HAZEL number and either get connected with myself or another support, or if again it's on the weekend, that those resources that you're able to connect with, and then just loop us into that, whatever that concern was when Keisha's back in the office, for example, on Monday. But we are absolutely here, but we do like to say that we are not a crisis service. And so again, we will always say 911. We always go through the crisis access line to make sure you have that, and then any other local Duval supports that you may or may not have awareness of.
Are there therapists who do CBT?
Great question. So, yes, sorry, I didn't see that question. So great question. So yes, our therapists are well-versed, again, and Keisha can speak to this in different types of modality. And so we do have therapists that have certain backgrounds. Sometimes I know that we do get those requests that, I want to work with a therapist that, is that knows CBT, that knows DBT, that is LGBTQ affirming, right? And so we do try our best when we are provider matching to ensure that we have you with the best therapists as possible, but because our therapists are trained and licensed, they do come in with a diversity of backgrounds for sure. Awesome. Well, these have been great questions. And so for sure, if you have anything else, then again, feel free to connect with, your school counselor, your school social worker about Hazel services if you're interested. Again, you have the information to do a parent self-referral as well. And, we hope that, we can support you in any way with you or your students.
All right. Thank you so much. Bravo to all of our presenters. We're so grateful for this wealth of information, families. I have no doubt that you learned something new today. Thank you for joining this Parent Academy course. On behalf of Duval County Public Schools, we appreciate you. We're glad you took the time out of your day to join us, and we hope to see you soon. If you have a friend that you think would benefit from this course, I wanted to let all of those know who came in a little bit later that we are recording this, and we will have this presentation available to view on our Parent Academy webpage, duvalschools.org/Parent Academy, or you can find Parent Academy under the departments. And we each month update our course recordings for courses that you may have missed the prior month. So we will have it available in about a week or so. Refer your friends so they can get the information as well. Thank you to all of you once again. Definitely thank you to our presenters. Hazel Health, it was wonderful. I learned lots of stuff myself. Good to see all of you. Take care, everyone. Enjoy the rest of your day, and we hope to see you again soon. Bye-bye.